Okay, so the doctor ordered to start an IV on my patient, so I've checked the orders. I have all of my supplies. I have my transparent dressing for after we insert the IV. I have my unopened IV start kit, my unopened catheter extension kit, and my unopened 22 gauge needle, and my 10 milliliters of normal saline, my clean gloves, and my towel. All right, so we're just gonna go into the patient's room now. Knock, knock. Hi, Mr. Smith. My name's Madison. I'm just going to be inserting an IV. Your doctor ordered me to start an IV for you. Before we get started, can you just confirm your first and last name, your date of birth, and if you have any allergies?
Yeah, my name is James Smith. Date of birth is 1/1/82, and I do not have any allergies.
Perfect. So I am just going to pick a vein. First off, we're going to open our IV start kit and grab our tourniquet. All right, it's just going to be a little tight for just a second while I pick your vein. And we're just starting your IV to get you some fluids and have easier access to give you some medications.
Okay.
All right, so I'm going to do this vein for you. We're going to release the tourniquet. All right, so now we're going to prime our catheter. Just going to grab my hand sanitizer and do hand hygiene real quick. All right, this is now trash, and so is the cap. All right. So I'm just going to apply the syringe.
At this point, I'm going to pack my supplies. I got my IV start kit here.
And we're going to loosen the cap. Perfect, the cap is loosened. And we're just going to prime it. Perfect, we have water. We're just going to leave that in there so it stays sterile. We're just going to leave that in there so it stays sterile. Alrighty. So now we're going to place a towel under your arm real quick. Perfect. Alright, I'm just going to do hand hygiene again. And now we're going to get our clean gloves on. Oh, biscuit. Alrighty. So now we're going to get our chlorhexidine, our unopened chlorhexidine, and now we're going to crack it. And we're going to cleanse the site up and down 2 to 3 inches using friction. We're also going to go around the IV site we chose. Alright, and now this is trash. Perfect. I'm going to let that air dry for 30 seconds. I'm going to get all my supplies, so we're just going to open that. We're going to open this. Prepared and ready for me to place on the patient after we're done. Alright, so it's been more than 30 seconds. We're opening our unopened 22 gauge needle that goes in the trash. We're going to inspect it. Everything looks good. We're going to uncap. That would go in the sharps. All right, you're just going to feel a quick poke. We're going to recap this because I did not do the tourniquet. Saw that. All right.
Are you sure? Yes.
All right, now we're going to uncap it again.
This is good. This is a little bit, but it's
And we're going to stabilize the vein. All right, you're just going to feel a quick poke.
Okay. And when you're prepping your stuff, take off your tape.
All right, we're seeing blood flash, so we're going to advance the catheter while pulling back the needle.
For yourself. Oh. Yeah, okay. All right.
All right, and we're going to hear the needle. Click. All right, we're going to stabilize the hub while releasing that, and then that goes in the sharps. We're going to release the tourniquet. All right, now we're going to add the Okay, we're going to pull back and get blood flash while stabilizing. We got blood flash, and we're just going to not insert, but flush with 3 mLs of saline. All right, and now we're going to undo this. Throw that away. All right, now we're going to tape it.
It's just a tight band so it can feel around for a vein. This one right here feels pretty good. I'm gonna pop that tourniquet back off. Okay, now
We're going to stabilize while pulling off the last piece. Going to flatten that out. All right, so it is stable. All right, and then we're going to tape the rest of it. We're just going to tape it right here. And then we're going to tape this up at the top. And we're just going to tape that up here. Alrighty, and then we're going to label this cute little sticker with our needle gauge, with the date. Student, nurse. And then I don't know the dressing. The dressing change date would be in like 24 hours. So then we're going to apply that right here.
It's just going to be a quick poke, okay?
All right. So now I am going to go and document the procedure. There was only one attempt at the IV insertion. We're going to document the site, which is on his right forearm. We used a 22 gauge needle, and the patient tolerated well. All right.